Polycystic ovarian syndrome, or PCOS as it's known, is a hormonal disorder and it's common among women of reproductive age. Women with PCOS may have infrequent or prolonged menstrual periods or excess male hormones known as androgens. The ovaries can develop numerous small collections of fluid and they can fail to regularly release eggs. There's currently no conventional cure for PCOS, and it doesn't go away on its own. Even after the menopause, women with PCOS often continue to have high levels of androgens as well as insulin resistance. This means that the health risks associated with PCOS are lifelong. The exact cause is unknown, but it often runs in families. It's been confirmed that women with polycystic ovarian syndrome have a high level of vitamin D deficiency. Hence, a correlation has been established between the serum vitamin D level and severe metabolic symptoms that are found in PCOS. It's been recently suggested that vitamin D deficiency may be responsible for the pathogenesis of PCOS. So you want to get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency that you have. In a randomized double-blind, placebo-controlled clinical trial of 84 patients who were suffering from PCOS, they were randomly put into two groups. One was given a placebo and the other was given 90 micrograms per day of vitamin K2 in the form of miniquinone 7 or MK7. They were given this every day for 8 weeks. Insulin resistance, lipid profile, endocrine biomarkers, and body composition of the participants were measured before and after the intervention. The study highlighted the benefits of the MK7 on the insulin resistance, the fat mass, skeletal muscle, serum levels of triglycerides, dihydrotestosterone levels, sex hormone binding globulin levels in the PCOS patients. Therefore, it seems that the MK7 supplementation might be an appropriate additive for PCOS patients. Previous studies have shown that the maximum amount of vitamin K2, which Weston Price nicknamed as Activator X for its many benefits, is not needed in doses higher than 300 micrograms per day, as this is the maximum amount that your body can absorb. Some studies have suggested that women who regularly consumed apple cider vinegar showed an improvement in the symptoms of PCOS. This is possibly because of its insulin-lowering effect, as one of the major reasons for PCOS is insulin resistance. It's easy to incorporate apple cider vinegar into homemade salad sauces and many other recipes. Zinc has many benefits for women with PCOS, including blood sugar balance, optimizing hormone production, and decreasing PCOS symptoms like unwanted hair growth or acne. Taking a zinc supplement can be very helpful in treating the root causes of the PCOS. You should just be aware that there's numerous forms of zinc available, and some have a very low bioavailability. Therefore, they would require higher doses than listed in order to achieve the required amount, which is normally 30 to 50 milligrams per day. You should also note that in order for zinc to get into the cells, the bioflavonoid quercetin is required. This could be obtained by consuming 500 milligrams of quercetin with your zinc supplement, or by taking unsweetened elderberry juice with it. A study shows that vitamin C plays a protective role against DHEA-induced polycystic ovary in Windstar rats via its antioxidant and anti-apoptotic mechanisms. You want to take vitamin C in the form of liposomal vitamin C for best results. The next best form would be a non-acidic pH-buffered vitamin C. The worst kind is a cheap acidic citric acid. Vitamin C's action is also enhanced with bioflavonoids like quercetin or elderberry juice. By changing the concentration of follicle-stimulating hormone, luteinizing hormone, and testosterone hormones in PCOS, evening primrose oil can reduce the complications of these hormonal changes. Evening primrose oil also reduces insulin and serum glucose and increases insulin sensitivity. The benefits of evening primrose oil are usually attributed to its gamma-linoleic acid content, its GLA. However, there's double the GLA found in borage oil, therefore it's a cheaper option. A typical dose of borage oil is 1,000 milligrams, taken 3 times per day. Berberine is a natural anti-diabetic compound, and it was shown in women with PCOS to improve the insulin resistance. And thanks to an increase in the expression of the GLUT4 in the ovaries, an improvement of the ovulation rate per cycle was also seen. So berberine is also effective on fertility and live birth rates in women affected by PCOS. Berberine has very similar action to the life extension product metformin. You can hear more about this in my video on life extension and my other video on the anabolic triad. Typical doses are 500 milligrams of berberine hydrochloride taken 3 times per day. Curcumin showed many beneficial effects similar to clomiphene citrate in treating PCOS and in inducing ovulation. Curcumin restored the hormone and lipid profile, antioxidant and glycemic status, as well as ovarian morphology in letrozole-induced PCOS animals. Typical doses can range from 1,000 milligrams up to 5,000 milligrams per day. Due to curcumin's low bioavailability, it should be taken with biopterin, which is a black pepper extract, or an oil such as fish oil, coconut oil, butter, or ghee. In women suffering from PCOS, low levels of selenium were recorded. The recommended daily dose for selenium is 200 micrograms. This can be obtained from a supplement or by eating 3 Brazil nuts per day. Previous observational studies suggested that there might be an association between elevated serum copper levels and postpartum depression. There's also been increased copper levels found in patients with PCOS. Try to get your levels tested and receive chelation therapy or some other corrective measure if any possible toxicity has been found that could be contributing to your condition. Chromium piclinate in doses of 1,000 micrograms per day were given to adolescent girls who were diagnosed with PCOS. It was given for 6 months and it significantly improved the regularity of menstrual cycles, decreased the ovarian volume, as was noted with ultrasonography, and decreased the number of ovarian follicles. Chromium is noted for its positive effects on blood sugar, so it's no wonder that it's helpful as PCOS is correlated with blood sugar disturbances. Another supplement that's often combined with chromium for its beneficial effects on blood sugar is vanadium, and this might be helpful here too. The use of insulin sensitizing drugs has been shown to improve both the reproductive and the metabolic aspects of PCOS. Cinnamon has been found to have insulin sensitizing effect, and it improves menstrual cycle in women with PCOS. Alpha-lipoic acid administration at a low dose of 400 milligrams daily improved the metabolic impairment of all PCOS patients tested, especially in those PCOS patients with familiar diabetes. Alpha-lipoic acid has been shown in animal studies when combined with the amino acid L-carnitine to extend lifespan, so it may have numerous other benefits to health. Typical doses can be higher than 400 milligrams per day. Some people recommend 600 milligrams taken 2 to 3 times per day. And speaking of L-carnitine, prescribing L-carnitine to clomiphene-resistant patients with PCOS improved the quality of ovulation, pregnancy rates, lipid profiles, and the BMI. It's been established that L-carnitine is safe, and it may be used to eliminate the long-term complications of PCOS. Typical carnitine doses are 2 to 3 grams per day. Hypothyroidism, low thyroid function, is known to cause PCOS like ovaries, an overall worsening of PCOS and insulin resistance. An increased estrogen and estrogen to progesterone ratio seem to be directly involved in high thyroid antibody levels in PCOS patients. You can check out my other video on hypothyroidism for more information on natural ways to help to treat this. One important point here is that nascent iodine supplementation is required by the thyroid to help the body produce all its sex and stress hormones. As PCOS is caused by an imbalance in these sex and stress hormones, nascent iodine may be beneficial. Another valuable nutrient required by the thyroid, which is found to be deficient in patients with PCOS, is the previously mentioned selenium. One way that selenium can be low is that it gets used up detoxifying the body. For example, if you have mercury amalgam dental fillings. Therefore, it would be wise to get these removed if you have any. Detoxification is also helpful in those with PCOS, as toxins can adversely affect hormone production. For example, the average American lifestyle no longer includes physical activity, which can impair natural detoxification pathways, such as sweating and regular bowel movements. In many of my other videos, I talk about the MTHFR gene variation and its link to numerous physical and mental health problems. Basically, it boils down to some people with this variation requiring extra supplementation, mainly of specific B vitamins, to ensure proper functioning of their body and to prevent the buildup of cortisol, stress hormone, and homocysteine. Women with PCOS are prone to coronary artery disease and hyperhomocystinemia, and it's an independent risk factor for coronary artery disease. The MTHFR deficiency is the most common cause of this hyperhomocystinemia, thereby provoking a possible association between PCOS and the MTHFR polymorphism. If you have this, it could require you taking not only a good quality multi-B vitamin with B12 in the form of methylcobalamin, but also a separate B12 methylcobalamin 5000 microgram sublingual tablet, plus folate in the form of methyl tetrahydrofolate. Other supplements would be trimethylglycine, MSM, DL-methionine. All of those are sulfurous compounds. You can see my other video on mental health problems, or research the psychological symptoms of undermethylation to learn more about this easily treatable condition. As it's linked to diabetes and blood sugar, you should adopt a low glycemic index diet by eliminating sugar and carbohydrates and increasing your protein, fat, and fiber intake. Moderate exercise like brisk walking, jogging, cycling, or swimming are great activities that can help with PCOS. This type of exercise increases your body's sensitivity to insulin, which reduces your risk of cardiovascular disease and of type 2 diabetes. A study published in the American Journal of Clinical Nutrition showed significant improvements in women with PCOS when they went on a carbohydrate-restricted diet. All the women who completed the study saw a significant improvement in weight reduction, waist circumference, body fat, insulin, total testosterone, and free androgens. 57% of the participants also saw significant improvements in their menstrual cycle regularity. Another study published in the same journal showed similar positive results, detailing their study of protein versus glucose on women with PCOS. This study showed an immediate drop in cortisol stress hormone and in DHEA during a protein challenge, and a spike in cortisol and DHEA during an oral glucose tolerance test. DHEA is a precursor hormone, and it's often too high in those with PCOS, as is cortisol. From this, they concluded that glucose ingestion caused significantly more hyperinsulinemia than did protein, and it stimulated cortisol and DHEA. Protein intake suppressed ghrelin significantly, longer than did glucose, which also suggested a prolonged satiety effect. These findings provide mechanistic support for increasing protein and for restricting the simple sugar in PCOS patients. The highest altitude growing root vegetable in the world, with adaptogenic properties, praised for being so powerful at hormonal balance, it was noticed that infertile sheep who ate this maca would then become pregnant. The root of the maca plant is a traditional herb, and it's used to boost fertility and libido. The maca root can help balance hormones and lower cortisol stress hormone. It may also help to treat depression, which can be one of the symptoms of PCOS. Where it's grown, it's eaten like a food, seldom raw. Therefore, it may be a helpful addition to cooking. The effects of CoQ10 supplementation in women with PCOS are being studied, and it's been shown to have beneficial results on the markers of insulin metabolism through modulation of insulin and adiopectin receptors, as well as an improvement in glycemic control and promoting an increase in the triglyceride lipolysis. Typical doses here are 200 to 400 milligrams per day, and the most absorbable form is ubiquinol. CoQ10 helps your mitochondria. Mitochondrial dysfunction likely plays a role in the pathogenesis of PCOS by increasing reactive oxygen and oxidative stress. This occurs in a metabolic milieu often affected by insulin resistance, which is a common finding in women with PCOS, especially in those who are overweight or obese. You can see my other video on mitochondrial boosting supplements for more information on supplements that can help, such as D-ribose, PQQ, etc. And most supplements only support the mitochondria. However, for research purposes, the research chemical SR9009, sublingually taken in DMSO, has been shown to be one of the only things that removes damaged mitochondria and replaces them with new healthy ones. You can also see my video on DMSO to learn more about this powerful substance too. Resveratrol is a natural compound found in red wine and in grapes. It can help address a hormonal imbalance in women with PCOS. This is according to a new study published in the Endocrine Society's Journal of Clinical Endocrinology and Metabolism. Doses of resveratrol are up to 1,000 milligrams per day, usually in the form of trans resveratrol. It has many other uses, such as blood pressure control and its potential for life extension. In a new study published in the American Journal of Psychology, Endocrinology and Metabolism, a group of women with PCOS were given acupuncture, where the needles were stimulated both manually and also with a weak electrical current. A second group of study participants were told to exercise at least 3 times per week, while a third group acted as a control. All the women were given information on the importance of regular exercise and a healthy diet. The study showed that both acupuncture and exercise reduced high levels of testosterone and led to more regular menstruation. The researcher who headed the study said in a statement that of the 2 treatments, the acupuncture proved to be the most effective. Other factors that should be considered include getting sufficient sleep. In one study published in the Journal of Clinical Endocrinology and Metabolism, researchers found that insulin sensitivity decreased in subjects by 19 to 25% after only 1 night of poor sleep. You can check out my other video on herbs to help you sleep for more information about possible solutions here. Antiandrogens like saw palmetto and spearmint tea may be beneficial here also, just like resveratrol. A study conducted in Turkey in 2013 studied the efficacy of omega-3 in the treatment of polycystic ovary syndrome, and it took 45 technically non-obese PCOS sufferers and had them supplement omega-3 at a dose of 1.5 grams daily for 6 months. This is only half of what many nutritionists recommend. Some recommend even going up to 9 grams per day. After the period of the test, the women showed decreased insulin resistance, less body fat, and most importantly, testosterone levels decreased, and sex hormone binding globulin levels increased significantly after the 6-month intervention. Increased omega-3 intake seems like the most straightforward, comprehensive approach for managing PCOS naturally. Some final lifestyle changes. Some foods to increase in your diet. You want to increase levels of all kinds of phytoestrogens, such as soybeans, tempeh, miso, red clover, lentils, linseed, and chickpeas, as these contain natural phytoestrogens, which help to balance the hormone levels in the body. You want to ensure that you eat plenty of essential fatty acids, like oily fish. You want to ensure that you eat good levels of fibre, as fibre promotes bowel movements so that excess hormones are secreted more efficiently through bowel movements. It also helps to manage your blood sugar levels, and it encourages the elimination of toxic products. Fibre can be found in whole grains and vegetables. You can eat plenty of fruit and vegetables, at least 5 to 12 portions daily. They contain fibre to keep the bowel moving, as well as a range of vitamins, minerals, and antioxidants, which support both healthy functioning of the body as well as the immune system. Ensure you drink enough water per day so that your urine is very pale yellow colour, not darker and not completely clear either. Enough water ensures daily bowel movements too, helping to flush out old toxins and hormones from the body. Ensure you eat quality protein at each meal, including breakfast, such as meat, fish, eggs, nuts, seeds, or soy. These help stabilize your blood sugar levels. When you eat carbohydrates, focus on low glycemic carbohydrates, including vegetables, whole grains, lentils, and beans, as this can help to stabilize your blood sugar levels.